So let's take a look at a heart to get a little better idea of what some of these congenital heart defects may look like and how they may actually affect our patient. Okay, so the first thing I want to go over with this heart is I actually want to talk about blood flow through the heart. So to give you some orientation as to where you're at here, right atria, right ventricle, left atria, left ventricle. Okay, that can kind of give you the orientation as to where you're at. And remember, blood flow through the heart, the blood will come up through the inferior vena cava, down through the superior vena cava, into the right atria here, and then through, if you remember what this valve is right here, right? So I always remember TPMA. So this valve right here is the tricuspid valve. And you can kind of see on the tricuspid valve that it has three little flaps. That's why we call it a tricuspid valve. And so the blood flow is going to flow down here into this right ventricle. And from the right ventricle, it's going to go up through the pulmonic valve, and it's going to go out to the lungs to be oxygenated. And then it's going to come back from the lungs. It's going to flow in right here. So remember, T, P, so this is M, mitral valve. So this is going to come down and through the mitral valve from the left atria now into the left ventricle, through that mitral valve, and then up through the aortic valve, which you have to kind of look to see, but it's definitely in there. There's the aortic valve down in there, okay? So when we're talking about congenital heart defects, many times what we're looking at is we're looking at valve issues. Now, one of sort of the more common valve issues is to have some sort of a pulmonary stenosis. And usually in a pulmonary stenosis, we're talking about this valve itself, okay? Now, that valve can be stenotic, so in other words, it's maybe thicker, or maybe the flaps don't open as easily, or it's harder, something like that. Or it can be insufficient. Remember, insufficient is when the valve doesn't fully close for a number of reasons. But one of the reasons could be that the valve is not quite the right size, and so you get some regurgitation back in here as well. And that's what, you've heard of maybe mitral valve regurgitation. Well, that's what we're talking about, is that regurgitation back through the valve. So that would be on the mitral valve. So remember, T, P, M, so that would be on the mitral valve, okay? But we could also have some pulmonary, some regurgitation back from the pulmonic valve. So if that valve is not closing exactly like it should, or something like that, we could have that regurgitation back from the pulmonic valve, okay? And that would cause a backup here into the right ventricle. Well, if you remember, the right ventricle is sort of I don't want to call it a low pressure system, but it's a little smaller. There's not as much myocardium to it, and so it's a little bit more responsive, if you want to say that, to some of those increases in pressure. So think Frank-Starling curve, right? When we talk about Frank-Starling curve, think about Frank-Starling curve and how that can affect your right atrial pressure here, okay? So we have that potential for mitral valve, maybe regurgitation. We could have not mitral valve, pulmonary valve regurgitation. We could have pulmonary valve stenosis, okay? Or the sort of top part of the pulmonary artery could also be a little smaller, or have some hardening to it, something like that, that's causing it to be a lot harder to get that blood to go out through that pulmonary artery. And so that might cause this right ventricle to kind of get bigger, right? So that's where you get that right atrial enlargement. The right atrium can get bigger, causing some problems. I mean, on your EKG, you might see some right axis deviation. So that's sort of talking about some of the valve issues. Now, I focused a lot on the pulmonic valve, but let's talk about maybe ventricular septal defects, so VSD, right? So when we have a ventricular septal defect, you can see that the septum here of the ventricles is doing a great job of keeping the blood flow from combining, right? We don't want that combination because remember, over here is our deoxygenated blood, over here is our oxygenated blood. So we don't want those two to combine too much. Otherwise, we get what's called purple blood, right? So it's red blood versus blue blood. It's not really red and blue, but we get that mix, okay? So that's what can happen in our ventricular septal defect, right? So if we have a VSD. An atrial septal defect, now the atria are a little harder because they're kind of hidden up in here, but an atrial septal defect would occur back in here, okay? And it could be something like a PFO, patent foramen there's other ones. We mentioned there's 4 total, and we'll talk about that at another point. But it could be that there's some flow going through here. So one of the things that I always mention is tetralogy of Fallot. And tetralogy of Fallot, the reason that I mention that is because it can cause a lot of problems for your pediatric patients. Now, tetralogy is probably spotted. It might even be spotted in an ultrasound before the baby is even born, and so the doctors know that they're going to have an issue before the baby's even born. And they can spot ventricular septal defects as well, potentially before the baby is even born. But tetralogy of Fallot is sort of what I call the perfect storm, right? So it's got a whole bunch of things in together that cause a problem. So you have that ventricular septal defect, right? So that ventricular septal defect causes blood flow to go across the ventricles. But then you also have what's called an overriding aorta. So the aorta is actually dropping into a place, pulling down into a place where the blood flow, instead of doing its normal, going up through the pulmonary valve, it's actually coming across and going up the aorta. Okay, and so you get that what they call aortic override, which then is causing some pulmonary stenosis in the pulmonary vein, or excuse me, the pulmonary artery, and in the pulmonary valve is what I meant, not vein, the pulmonary valve, and then of course out into the pulmonary artery, causing some issues there. Okay, so that's one of the like I said, the sort of the perfect storm. Okay, one of the biggest concerns is that a pediatric cardiac malformation or a pediatric cardiac congenital heart defect will turn into something that causes us to see a scene like this. Like that, right over there. And that's a concern.